Hello.
Hey.
Waiting on the MBA?
Yeah, there's two, I think. Old people.
Everything came back clean. That's the important thing.
I never knew you were such a sissy.
I never knew you were such a slut.
Sorry for the inconvenience.
You know, I don't remember any complaints in Jamaica.
Bitch.
You know, and I think thousands of people wake up every morning to Susie and Leland.
Margaret Evans, 72, rollover MVA, restrained passenger in a second, hypotensive and altered.
From the seatbelt?
Had to cut her out.
Hold that tight, sir.
Her husband, Thomas, they were in a church van on its way to a miracle healing site.
A what?
Virgin Mary's face on the side of a barn.
How'd that work out for them?
They never got there.
Ooh, naughty nurse.
A naughty nurse.
I like it.
Ooh, it's an old-fashioned nurse.
Looks naughty to me.
So you were, what, like a kurva nurse? Or
What's that?
how do you say a slut? You know, like a tramp, a whore?
Got it. You know, maybe I should have worn that schoolgirl's outfit you bought me.
She's making a joke.
Will you page me when Weaver gets in?
Oh, she's not coming in. She called in sick.
Again? Must be nice to be the queen.
No, I think it's legit. Sounded like she was puking.
We call that a hangover.
Yo, Dr. Lewis, check this out.
I hate Halloween.
This is not a costume.
Like I said.
Just sit down, man.
I can't sit down.
Yeah, go get you a pain shot, man.
Excuse me, I'm looking for Dr. Corday.
Try one of the trauma rooms.
Oh, I told you not to eat all your candy at once.
Oh, sorry about that, man. I'm looking for Dr. Corday. All right, this way. You from the burn unit? No, I'm a med student.
Go on. This one jumped off a balcony to escape the fire.
Yeah, it looks like a calcaneal fracture. Get a two-view x-ray.
Can I give us something for the pain?
Is she pregnant?
I'm on the pill.
Start with a Vicodin. Take these. Dr. Corday should be inside. Okay.
I gotta go. I'll call you as soon as I hear anything. Did you stop the infection?
Yes. But the infection had already spread to the lower part of his thigh.
But he's gonna be okay.
In order to save Jason's life, it was necessary to amputate his leg.
What?
Well, we considered several options, but in the end, we felt that any less aggressive treatment would run the risk of further infection.
You cut off his leg?
It's an above-the-knee amputation, which will allow Jason to walk independently with a prosthetic.
Are you kidding me? He had a bug bite. You don't cut off a man's leg because of a bug bite.
He'll pretty much be able to do everything he did before.
With a fake leg?
Yes. It will take some getting used to, but with physiotherapy... Excuse me, where are you going?
I can't stay. This is all a little too freaky.
Well, I'm sure Jason would like to speak with you.
We've only been going out 2 months. I'm sorry, but I don't even like hospitals. Just tell him, I don't know, tell him whatever you want.
I need some help.
What happened?
Patient's post-ictal lacerated her scalp when she hit the pavement.
What was she doing outside?
That's Karkins.
Oh my God, Sarah.
Came in this morning, altered, possible ingestion. Jerry, can you page Dr. Corday?
Yeah, I thought she was an OD.
Well, she's a trauma now. She's seizing. Seems pretty busy, huh?
Yeah.
She denied any medical history. Can you seize from a ground level fall?
Ingestion, electrolyte abnormality, tumor, bleed, hard to tell. To Ativan.
Can you give Ativan IM? She doesn't have a line.
Not as effective. Abby?
Can you hold her arm down?
Are you serious?
Yeah, very. No one mentioned she was seizing.
She is not.
Boy, that's nasty. 6-centimeter jagged scalp plait. Looks like it's torn straight through to the bone. What was she in for?
We don't know for sure. Police found her asleep and hard to rouse on the L.
Possible drug overdose.
Possible brain bleed. I just don't understand these girls who'll take any pill handed to them at a party.
Dr. Corday,
Yeah.
can you witness a DNR? I need a second physician's signature.
Oh, there's no gag. She's not protecting her airway.
I got it.
Thanks, Luca. Okay. Let's intubate her and then get her up to CT. You care to do the honors?
Yeah, sure.
Scope in the left hand. Sets 98. Slide along the tongue. Across and out of the way. Good. That's excellent. Now look for the chords. Remember to be extra gentle to the nurses while saving patients, or they might have you suspended.
Do you know any of the facts, or do you just resent filling in on a rape exam?
I just know it's hard enough to get a decent ER doc at County without the added pressure of requiring perfect etiquette.
The nurses are interchangeable.
Excuse me, is this the cervix? I think this is the cervix.
Small tear at the introitus.
What does that mean?
Semen present. He really wants to talk to somebody.
Check the culture for GC and chlamydia.
Got it.
You'll need consent for a full kit.
Only done about 100 of these.
Good for you. Repeat a CBC in an hour and call me when he's back from cardiac echo.
Dr. Corday, may I ask why you won't consider hospitalization to treat Mr. Seaton's cholangitis?
We can do that at home, which is where he wants to be.
How about a new stent?
He's already had 2. It would only get obstructed in a few weeks.
Perhaps we could have the oncologist suggest a new chemotherapy agent.
I don't think he wants to spend his final days vomiting and septic.
Look, I know that I can be a little...
Overzealous.
I was gonna say tenacious.
You're trying to do everything for your patients, and I envy your perseverance, Mr. Nathan, but there are times, like this, when the best thing we can do is nothing at all.
Dr. Corday, Mr. Seaton's family's here.
What are you gonna tell them?
The truth. He's dying.
Didn't feel it, and I'm not so sure you did either.
I felt an olive. You just needed to wait until he stopped crying.
His history was classic. 6-weeker, non-bilious projectile vomiting. You were just playing a hunch.
It's called clinical suspicion. Most good doctors have it, and you'll probably develop it too one day.
She dished you, man.
What is her problem?
Isn't it obvious? She's hot for you.
What?
I'm serious. All that hostility is just misplaced sexual tension.
Yeah, right. All she ever does is ride me.
Yeah, that's because she really does want to ride you.
If I were you, I'd get me a saddle.
Hi-ho, Harkins!
Do you guys mind?
He was brought in a combative state. I gave him 5 of Haldol, and now he appears to be catatonic.
It's not a coma?
No, he blinks on command. He seems to be locked in.
Hi.
Did you get a head CT?
Yeah, it's negative. No tumor, no bleed.
May I?
I was thinking maybe it might be a depressed or psychotic state with mutism.
Markedly increased muscle tone. Does he have a history of Parkinson's?
I don't know. He still hasn't been ID'd. Why?
He has masked facies. The Haldol would have induced the catatonia and stiffness.
He's right. In Parkinson's, the substantia nigra needs dopamine.
And Haldol is a dopamine antagonist, which makes the symptom even worse.
He needs a Cinemet right now.
No, he can't swallow a pill like that, and you can't give it to him in an IV or IM.
Well, drop an NG. Crush the Cinemet, 25 to 100, mix it with a little water, push it down the tube.
Okay. Nicely done.
Yo, Nathan. OR's calling for you. Corday wants you upstairs ASAP.
So I guess you win. Oh, you got to help Kovai save that little boy.
I wish I hadn't. I hate seeing kids in here. Probably would have run out of the room if I hadn't been so scared.
Oh, they say you get used to it.
Yeah, just when I think I'm ready for all this, something comes along that makes me start to question everything. There's no study guide for that.
I think that's why they created ice cream sundaes.
Chocolate sauce, whipped cream.
Peanuts? My treat? Truce.
Truce. Till tomorrow.
Of course.
How long have you had Parkinson's?
12 years. You?
7. I'm gonna suggest they give you another Cinemet, 10-100.
I upped my dose today because the tremors are getting worse. I guess I overdid it.
Yeah, it happens.
Mr. Nathan, do you have a minute?
Sure. Excuse me. Sorry about the punch earlier.
Happens. Only sorry I couldn't give you one back.
Well, next time.